Hi, everyone. Thank you for joining us. My name is Donna, and I'm with GENESIS Fertility. Conducting today's webinar is Dr. Alex Kotlyar of GENESIS. I'm going to ask everyone to please hold all questions until the end of the presentation. Without further delay, I'll turn the controls over to Dr. Kotlyar.
So good evening, everyone. I'm Alexander Kotlyar, one of the reproductive endocrinology and fertility specialists at GENESIS. I'll be doing this evening's webinar on what you should know before getting pregnant. This is a bit of a dry topic, so I did include some animal pics here just for emphasis and general cuteness, as shown on the slide. The key topics that we'll focus on are the pre-pregnancy evaluation and health maintenance, optimizing any pre-existing conditions, focusing on diet, exercise, and what supplements to take, and in general on what is fertility and how to proceed with trying to conceive. First step for pre-pregnancy evaluation, we have to focus on health maintenance. That's why the annual exam is very, very important. For the annual exam, it's key that you mention to your internist, to your OBGYN, that you want to get pregnant within the next year. That focuses the discussion and also the evaluation on making sure you're optimized to achieve a pregnancy and to sustain a healthy pregnancy. Part of that, it requires that they check your vaccinations, that you're up to date on rubella, varicella, and if you didn't get those vaccinations, or if you don't have antibodies to those, they would recommend that you get those vaccines. And the reason why we recommend those is because those viruses like rubella and varicella, if a woman who isn't immune then gets infected during pregnancy, one, she can get very sick, and chickenpox is a bit of a nuisance and a cool excuse to stay home when you're a child. But then when you're an adult, you can get very sick and get very bad pneumonia, and it hits pregnant women especially hard. Plus, both of these viruses can lead to very serious birth defects. So vaccinations are key. Also making sure that screening is up to date. For example, a woman should have an up-to-date pap smear. Depending upon her age, if there was a normal one within the past 3 to 5 years, if her prior history was normal. And also depending upon age and personal history, family history, an up-to-date mammogram. Now, as far as other aspects of the annual exam, reviewing your own and your partner's family medical history, and that's geared towards assessing for any genetic disease risk factors. Combined with that, we recommend that any couple planning to conceive consider genetic carrier testing. So all of us, no matter who we are, where we come from, we all carry various genetic conditions. It becomes more of an issue when both components of a couple overlap for a certain genetic condition. Very common ones are cystic fibrosis or spinal muscular atrophy, SMA. And because of the mix of genes in the population and the general mix of ethnicities and racial groups, we do what's called expanded carrier testing. So instead of saying, oh, we should only do the genes for this group or that group, we lump it all together. We don't assume anything, and we test for hundreds of genes for each person. And if there's overlap, that involves a different discussion about how to minimize the risk for genetic disease. Now, other key aspects are minimizing any adverse intake. For example, alcohol, tobacco, or any other substances that we just don't believe are that conducive to health or to having a child. So the goal is to, of course, minimize and eliminate intake of those. Another not very often discussed topic is interval from recent delivery. So ACOG, the American College of OBGYN, recommends that women who are planning to get pregnant, who've had a prior pregnancy, time their next pregnancy, the next start of their pregnancy, at least 6 months and ideally 18 months since the last delivery. because if the interval is too short, then they're at higher risk for preterm delivery, small birth weight, and preeclampsia. So a little bit of timing is essential. Now, I said animal pics. These kittens, they made it to their annual visit. You can definitely make it to yours. Now, optimizing pre-existing conditions. I listed a few very common ones like asthma, so make sure you have a very stable treatment regimen. Hypertension, just make sure your blood pressure is under control, because in pregnancy, there are numerous conditions like preeclampsia, or rather a spectrum of conditions that can lead to elevations in blood pressure. Also, an important note is to minimize the hazardous medications to minimize any medications that could be hazardous to a pregnancy. And one example are medications called ACE inhibitors. Common names are lisinopril or enalapril. They work great as blood pressure medications, and many women do take them, but they can lead to kidney development issues in a pregnancy for the fetus. For diabetes can be teratogenic, meaning can lead to birth defects. That's why a woman's blood sugar should be kept under very good control. And one common measure of a woman's blood sugar is her hemoglobin A1C. It's a percentage of a certain kind of hemoglobin. And diabetes, we define that as 6.5% or higher. Women with diabetes should have a hemoglobin A1C of less than 7%, just to minimize the risk for excess birth defects. And general rule, all pre-existing conditions should be stable, and the medications should be okay for pregnancy. You can also ask, well, what medications are okay for pregnancy? The FDA actually has a list of medications, or classifies medications as those that are safe in pregnancy. They use a classification system. They used to use an A, B, C, D, and X classification system, with A being totally safe and X meaning under no circumstance should you use it. They've gone a little bit away from that now, but you may see classifications like that. So the squirrel is conveying just that. So stop and make sure everything is properly controlled, that all the specialists that you see are okay with your health status, in addition to your annual exam. And if you have not made it to at least 6 months since delivery, stop, give your body a rest. And then once you hit that 6-month mark, ideally 18 months, then you can proceed on with trying to conceive. So also, diet and exercise, very important, because you need to maintain a normal pre-pregnancy weight. That can also have implications for pregnancy. So ideally, the BMI is kept below 30. And then also maintaining a balanced diet. And that has a twofold effect. One, it helps in maintaining a good pre-pregnancy weight, and also it helps build up the supply of nutrients in your body. So one fantastic resource is myplate.gov, and they have this very convenient and very easy to interpret plate diagram, which shows that roughly half the plate, ideally, should be fruits and vegetables. The other half should be grains and protein, with a portion of dairy. That website also goes into how to design a good meal regimen for you based upon your age and health status. What's also important is to start a prenatal vitamin or a supplement that has at least 400 micrograms of folic acid. That's necessary to minimize the risk for what we call neural tube defects. Basically, the spinal cord does not form properly, and that can lead to some severe neurological issues and potentially delivery issues for any pregnancy. And the recommendation is that you start a prenatal vitamin really around 3 months before you start trying. Pregnancy is a very calcium and iron intensive process. So while you're trying, try to increase iron-rich foods and calcium-rich foods. You can increase the dairy too. As far as exercise, the ideal is 30 minutes each day, 5 days per week. And that involves moderate level activity, which involves moderate level activity involves just working out to the point where you're a little out of breath, your heart rate is increased, and that's the minimum you should aim for. If you want to do more intense exercise, of course, within reason, then that's encouraged, and it should be a mix of aerobic exercise, so brisk walking, running, other forms of cardio, and at least 2 to 3 times per week, some weightlifting. Now, as far as supplements, one thing to note is not all supplements are the same. The supplement industry is not as tightly regulated as pharmaceuticals, but some companies do voluntarily submit their products for FDA testing, and they'll have the symbol, as shown in the lower right, USP. And that shows that they've voluntarily submitted themselves to government testing. So not all companies do that. So I would just be aware. I would just look out for that symbol. Those would be my recommendation for what to get. Otherwise, they're all pretty much the same. And of course, have to have one more cute animal. A husky eating his broccoli. Broccoli is rich in folic acid. Follow the husky's example. Now, going on to fertility. What is fertility? Broadly speaking, it's just the capacity to produce a child. 80% of couples will conceive in the first 6 months of trying. So that's an important number to note, because there's certainly a lot of pressure that I've seen in my own patients, and when a couple is trying, many of them seem to have a sense that they need to get pregnant within the first several months. That's not the case. And I think having this perspective that, really by 6 months, 80% should conceive, by a year, 85% will conceive, that I think just helps aid in taking a little bit of pressure off and just gaining a healthier perspective. So age is definitely a factor when it comes to fertility. So for a woman in her 20s and 30s, that fertility is about twice as high as when a woman is in her 40s. And this is evidenced by, or depicted in this chart. This is from the American Society of Reproductive Medicine, showing pregnancy rates according to age. And so we can see that by around the age of 35 to 37, we've seen an acceleration in pregnancy rates per month. So also relatively well known, but I think this figure depicts it the best out of any that I've seen thus far. Now, when you're trying to get pregnant, it's important to be aware of the quote unquote the fertile window. So that's a 6-day period that includes the day of ovulation when the sperm is most likely to meet the egg. And then once they meet, they fertilize, and they can lead to a pregnancy. So while the chance of pregnancy is possible for each of those days, it's highest in the 1 to 2 days right before ovulation. So that begs the question, well, then how often do you time intercourse? Actually, there's no concrete number. Having intercourse every single day is totally fine. What's not good is to have it too infrequently. So having it more than every 5 days is not ideal, because timing intercourse less frequently can actually lead to a small decrease in sperm concentration. So this also very nicely depicts the chance of pregnancy for each day of intercourse. So if ovulation is around day 14, hoping all of you can see my cursor, and we can see the peak is like at around days 12 and a half to 13, right there. Now, that brings up another question. How do you track when ovulation may happen? There are a few ways to do that. So there's the calendar method. There are many great apps. There's actually one great article recently that Clue is very accurate as an app. Just for full disclosure, I have no interest or association with Clue. But the article that assessed it in other apps was really good. There's also basal body temperature, which women typically measure early in the morning before they get up, within the first 5 minutes of getting up. And then when you have that ovulation, when you're close to ovulation, you should see that increase in the basal body temperature. There are also urine ovulation prediction kits, and for me, I like these urine ovulation prediction kits because they show you the biochemistry. They show you when you get that surge in the ovulation hormone, and that ovulation hormone is LH. For those of you who want to know some of the nitty-gritty. And so once you get that elevation, that usually it comes up as two lines in the test. They have a control line, which is always there. Once you get that second line, that tells you that you're likely going to ovulate within the next 24 to 48 hours. So within the next 1 to 2 days. Bottom line, once you see that second line, you have sex that day, the next day, and no reason not to have intercourse the day afterwards. Now, when to be concerned about infertility, depends upon age also. If it's less than 35, if after 12 months of consistent trying. Now, how do we define consistent trying? Having basically unprotected intercourse, ideally 2 to 3 times per week, but even if after a year of having intercourse, just say once a week, and you're not pregnant, that's still concerning. So regardless, if you've been having 12 months of unprotected intercourse, consistent intercourse, then you should see a specialist. And if you're 35 and older, that cutoff is more strict after 6 months. But to be proactive, you can come in a little bit earlier. So if you're approaching like the 10-month mark and there's no success, then it's always good to start some evaluation. And then when you if you end up reaching the 12-month or 6-month mark, then treatment can be done. So just have to finish off with a few more cute pictures. But ultimately, these are the most important animals, creatures that we want. So that's ultimately our goal here at Genesis. Thank you. Any questions? You can absolutely get pregnant, and we've had many patients who are over 40 and are getting pregnant. It's just that it's quite a bit harder because with time, eggs accumulate DNA damage and chromosomal abnormalities. And if an egg has chromosomal abnormalities, the embryo will have chromosomal abnormalities. And so at the age of 40, about 65% of the eggs on average may have abnormal chromosomes. Still, that means that 45%, maybe slightly more, or pardon me, 35% or slightly more will be chromosomally normal. So it's totally possible. It's just that it may take more tries, or it may take a little bit longer to conceive, or if treatment is done for infertility, it may take more rounds of treatment. Generally, medications for osteoporosis, for the most part, aren't recommended in pregnancy. I have to look back at the generic name, but definitely bisphosphonates, like alendronate or risendronate. They can affect fetal skeletal development, so generally not recommended. So it very well could. There are at least a few good studies showing that women who do acupuncture around the time of IVF, and especially around the time of embryo transfer, could have somewhat increased pregnancy rates, whether that's due to improved blood flow or just in general reduced stress, reduced cortisol. We don't quite know the mechanism, but I strongly recommend if patients wish to do acupuncture, I strongly recommend it. For CoQ10, the studies have shown to improve egg yield, ideally at least 1 and ideally 2 months before the start of any treatment cycle. And the dose is 200 milligrams 3 times a day. For DHEA, the dose is 25 milligrams. The studies recommended taking it 3 times a day also, but the group that did those studies recently pulled back a little bit on the recommendation, given that some women were experiencing elevations in cholesterol and some acne. And I usually recommend that my patients just take it once, maximum twice a day. In general, most skin products should be totally okay. Like the vast majority of commercially available shampoos, conditioners, body lotions. That should not have any bad effect on any pregnancy. It's with makeup that you can get into some concerns. First of all, the components of makeup. There's a lot of really fascinating chemistry that goes into that. By the way, I was a chemistry major in college, so that's why it is. That's why it kind of lit up a light bulb. What can you say? So with all the compounds used, the pigments, the carriers used in makeup, some of it isn't necessarily teratogenic, like it won't necessarily cause birth defects. So I think in low doses, most commercial cosmetics are totally okay. But there are certain additives that could increase cancer risk. So there is a nonprofit that actually tracks cancer risk for various cosmetic products. So in terms of trying to get pregnant, no contraindications. You can certainly fly anywhere you want. Just take typical precautions, meaning just taking care of yourself in any new locale. While you are pregnant, however, you can certainly fly. Ideally, you're not flying long distances, no more than say like 6 hours or a transatlantic flight, because then you spend more time in your seat. The bigger risk with flying in pregnancy is that pregnancy is a state where you're at higher risk for blood clots. And if you're in a cramped seat, not moving around for like 6 hours or more, and you're pregnant, you're at substantially higher risk for getting a clot in your legs, which puts you at risk for getting a clot in your lungs, and that can be an extremely serious situation. Yes, there are absolutely limits with that. So with tuna, for example, commonly eaten fish, you shouldn't eat more than 1 can per week. Definitely while you are pregnant, and I would say also while you're trying to get pregnant. I would say you should avoid higher order species, meaning fish that are higher up on the food chain, like for example, swordfish, because the higher up on the food chain you go with seafood, the more contaminants and heavy metals like mercury and lead that are concentrated in that fish. Because if you think about it, they're taking up more of the lower order animals in the food chain, and they're concentrating all of those contaminants and heavy metals that could be hazardous for you. Of course, not to say that, say if you want to have some tuna, you certainly could. But other high order, more predatory fish, you should avoid. And as far as other forms of seafood, so long as everything is thoroughly cooked. And as far as shellfish, I haven't seen any limits as far as amount, but you can't go wrong. You can't go wrong with moderation. It's just the higher order animals that you have to be careful of. So the quick answer is the studies have been done to see if any particular diet or particular foods are ideal or maximize the chance for IVF success. And to see those differences, we need to do like big studies, randomized controlled trials to see that. I'm hoping that one day soon they'll be done, but we just don't have that data yet.
Okay.
There's some very, very limited data showing that a Mediterranean diet may be better than others. And just in general, diets that limit excess sugar, for example, and help maintain a healthy weight are the best ones, because we know that with excess sugar, with excess weight, that can decrease the chance for implantation of an embryo and is associated with a higher chance for miscarriage. Also a great question. So for IVF, you don't have to wait until your period happens, because we typically want to start IVF when a patient is very is in general suppressed. If the period does happen before IVF starts, then that won't hurt anything. But bottom line, you don't need to wait. For IUI, because the medications that we use, they depend on stimulating your body's own release of hormones, and Lupron can tamp that down. So it actually is better for women that were treated with Lupron for endometriosis, wait until the next period, and then they can start an IUI cycle.